Have you ever looked at a bill and felt your stomach drop, not because you didn't understand it, but because you suddenly realized this wasn't supposed to happen to you? Comment your name and state below. I'd love to see who's watching and benefiting from these videos. I hear from people every single week who say, "I thought I did everything right. I chose the safe option. I chose the affordable option." And yet here they are, holding a stack of medical bills they never saw coming. Today I want to walk you through something that almost nobody talks about, something that quietly impacts millions of people on Medicare, especially those on Medicare Advantage plans. And I want to do it calmly, honestly, without scare tactics, so you can actually understand what's going on and what your real options are. Right now, there are roughly 68 million Americans on Medicare. More than half of them, about 35 million people, are enrolled in Medicare Advantage plans, also called Part C. These plans didn't become popular by accident. They're marketed as simple, affordable, and complete. Many of them come with a $0 monthly premium on top of what you already pay for Medicare Part B. They often include drug coverage, and they advertise extras like dental, vision, and hearing. For someone living on a fixed income, that sounds like a smart decision. And for many people, it can be. But here's where the story usually changes. What most people don't fully understand when they sign up is that Medicare Advantage is a pay-as-you-go system. You're not paying much upfront, but you're paying along the way. Every doctor visit, every specialist, every test, every hospital stay comes with a cost. And those costs don't feel big at first. A $35 copay here, a $50 copay there. But life doesn't always stay small and predictable. Sometimes it takes one diagnosis, one hospital stay, one ambulance ride to turn manageable costs into overwhelming ones. Let's zoom out for a moment and talk about medical debt, because this isn't a rare problem. Around 100 million Americans report having some form of medical debt. Together, that debt adds up to over $220 billion. Not million. Billion. Seniors are not immune to this. In fact, many are more vulnerable. Surveys show that the average senior reports having about $2,000 or less readily available if a medical emergency happens. That doesn't even cover the lowest maximum out-of-pocket on many Medicare Advantage plans. So before we go any further, let's ground this in reality. You can do everything right, choose a plan that fits your budget, follow the rules, and still end up facing thousands of dollars in out-of-pocket costs in a bad health year. That's not because you failed. It's because the system is built this way. To understand why, we need to briefly review the three main ways people use Medicare. Some people, usually unintentionally, are on original Medicare Part A and Part B only. Part A is usually premium-free if you worked long enough, and Part B has a monthly premium. The problem with this setup is not the premium, it's the gaps. Original Medicare generally pays about 80% of covered services. You're responsible for the other 20%, and there is no cap. If you have a major medical event, that 20% can be financially devastating. The second option is original Medicare combined with a Medicare supplement, also called a Medigap plan, plus a separate Part D drug plan. This is often considered the most comprehensive coverage. No networks, predictable costs, access to doctors nationwide, and acceptance at major medical centers. But it comes with a higher monthly cost. By the time you add Part B, a Medigap premium, and a Part D plan, many people are paying several $100s a month. For some, that's worth it. For others, it's simply not possible within their budget. That's where Medicare Advantage comes in. Advantage plans replace original Medicare and bundle everything together. You still pay your Part B premium, but the plan itself often costs nothing extra per month. Drug coverage is included. Dental, vision, and hearing are advertised as added benefits. For 2026, though, we are seeing important changes, especially with dental. Many Advantage plans have scaled back dental benefits. What used to be broader coverage is now often limited to cleanings or basic services, sometimes with very small provider networks. It looks good on paper, but when people try to use it, they're often surprised by how limited it really is. Still, the appeal is obvious. Lower monthly cost, extra benefits, and simplicity. The trade-off is how you pay when you actually use the plan. With Advantage plans, you pay copays and co-insurance for most services until you reach your maximum out-of-pocket limit for the year. That limit depends on the type of plan. HMOs tend to have lower maximums, often a few $1,000s, but they come with strict networks. PPOs offer more flexibility but usually have higher maximum out-of-pocket limits, sometimes reaching $7,000, $8,000, or even close to $10,000. That number resets every year. One bad year can wipe out years of careful budgeting. Here's where real life comes in. People don't plan to get sick. They choose Advantage plans thinking, "I'm healthy. I rarely go to the doctor." And that may be true today. But health can change quickly. A cancer diagnosis. A heart issue. A fall that leads to surgery and rehab. Suddenly, those copays stack up fast. Hospital stays often come with daily charges for the first several days. Ambulance rides have their own costs. Skilled nursing facilities may only be partially covered. And all of it pushes you closer and closer to that maximum out-of-pocket. This is where many people feel blindsided. They didn't expect a $0 premium plan to cost them $5,000 or more in a single year. And yet, this is exactly how these plans are designed to work. Now here's the part that doesn't get talked about enough. There is a smaller, secondary type of coverage that can dramatically reduce this risk for people on Medicare Advantage. It goes by different names, but it's commonly called a hospital indemnity plan or copay protection plan. And despite how powerful it can be, it's often overlooked. This is not a replacement for Medicare Advantage. It's a companion policy. Think of it as a shock absorber. Instead of changing your main plan, it helps cover the costs that hit you when something big happens. These plans are offered by private insurance companies and typically have very low monthly premiums, often starting around $15 to $25 per month, depending on age, benefits, and riders. What they do is pay you cash benefits when certain events happen, like a hospital admission, a hospital stay, an ambulance ride, or sometimes a cancer diagnosis. That cash can be used to pay the copays and co-insurance from your Advantage plan. Let's make this practical. Imagine your Medicare Advantage plan charges $300 per night for the first 5 nights in the hospital. That's $1,500 out of pocket. A properly matched hospital indemnity plan can pay you a daily benefit that offsets or even fully covers those charges. The same idea applies to ambulance rides, skilled nursing stays, and other common high-cost events. What makes these plans especially useful is customization. You don't have to overbuy coverage you don't need. The benefits can be aligned with the structure of your Advantage plan. If your plan has high hospital copays, you focus there. If ambulance costs are a concern, you add that rider. Some plans also offer lump sum cancer benefits, which can be incredibly helpful given how expensive cancer treatment can be under Advantage plans. Approval is often easier than people expect. Many plans are guaranteed issue during certain periods, including when you first enroll in Medicare. Some companies offer guaranteed acceptance up to certain ages without medical questions. That makes this option accessible to many people who wouldn't qualify for other types of coverage. This doesn't mean Medicare Advantage is bad. It means it's incomplete on its own for many people. Advantage plans can absolutely be the right choice, especially when budgets are tight. But pairing them with a small copay protection policy can turn a risky setup into a much more stable one. As we move into 2026, this conversation becomes even more important. We're seeing continued tightening of benefits, narrower networks, and reduced extras like dental. At the same time, healthcare costs continue to rise. Ignoring out-of-pocket exposure is no longer safe. I've talked to people who were financially stable for decades and then one medical year changed everything. And I've also talked to people who had the same medical events but stayed financially intact because they had layered their coverage wisely. If you're on a Medicare Advantage plan right now, the question isn't whether your plan is good or bad. The real question is whether you could handle the worst-case scenario if it happened this year. If the answer is no, then it's worth looking at ways to protect yourself. That's why education matters. Not fear. Not sales pressure. Just understanding how the system actually works and making informed choices. You don't need to be wealthy to protect yourself. Sometimes, a small, affordable adjustment can make a massive difference. If this video helped clarify things for you, take a moment to think about your own situation. Look at your summary of benefits. Look at your maximum out-of-pocket. Ask yourself how you'd cover it if you had to. And if you want guidance, working with someone who understands these plans can save you from learning the hard way. Again, comment your name and state below. I really do love seeing where everyone is watching from, and it helps others feel less alone navigating this confusing system. Medicare doesn't have to be overwhelming. With the right information, you can make choices that protect both your health and your financial future.